Assalamualaikum, good day. Welcome back to PHC562 lecture with the title of Bipolar Disorder. In 2021, actress Jananik broke her social media silence and announced that she has been diagnosed with bipolar disorder. Jana, or her real name Nurul Jana Munir, shared the news via her Instagram. And this actress has also revealed that she attempted suicide twice before and had been having suicidal thoughts since she was 8 due to harassment from her childhood. Jana also admitted that she thought it was normal for her to hear multiple voices in her head until she started taking her medicine. Her post in Instagram has got over 100,000 likes with supporting comments from fellow artists and fans. What is actually bipolar disorder? Bipolar disorder is a serious brain illness and it's not the same as the normal ups and downs everyone goes through. The mood swings are more extreme than that and are accompanied by changes in sleep, energy level, and the ability to think clearly. Bipolar symptoms are so strong that they can damage relationships and make it hard to go to school or keep a job. They can also be dangerous. Some people with bipolar disorder try to hurt themselves or attempt suicide. Please bear in mind not to be confused with multiple personality disorder. Bipolar disorder is also called manic depressive illness or manic depression, and in bipolar disorder there is a cyclical presence of highly elevated or agitated mood known as the manic episodes and depressive episode or depression. People with bipolar disorder go through very unusual and extreme mood changes. Sometimes they feel very happy and up and are much more energetic and active than usual, and this is known as the manic episode. Sometimes they feel very sad and down and have low energy and are much less active, and this is known as depression or a depressive episode. Most commonly, the symptoms, whether it is manic or depressive episodes, would continue for weeks to a few months without treatment. Abnormal behavior during a manic episode include flying suddenly from one idea to another, having rapid loud speech, decreased need of sleep, and behaving generally hyperactively. They usually also have an elevated sense of self-image as well as hypersexuality. On the other hand, depression episode can be seen or can be observed as weight loss or weight gain, psychomotor retardation, a generalized loss of energy or constant fatigue, feelings of worthlessness as well as decrease in concentration, and marked indecisiveness when making decisions. Bipolar is an irritable disease and it appears to share susceptibility genes with schizophrenia. It is characterized by dysregulation in the neurotransmitter system as well as by abnormal neurocircuitry. Basically, pathological changes in the brain involved in regulating emotion, and this can be triggered by various environmental factors such as traumatic events or life stresses. Drug treatment for bipolar disorder has three symptom targets: manic symptoms, mixed episodes, or depression, and it is usually given in stages. In acute treatment, the objective is to resolve an episode that has already developed, and in maintenance treatment, the objective is to delay the occurrence of future episodes, minimize the severity of episodes that do occur, and reduce the severity of symptoms between episodes. In most countries, these are some of the approved drugs for management of bipolar disorder. Of course, we have the mood stabilizer lithium, the traditional or typical antipsychotic chlorpromazine, the anticonvulsant valproic, the atypical antipsychotic olanzapine, as well as lamotrigine. Other medication use off-label for bipolar disorder includes other anticonvulsants, for example, carbamazepine, oxcarbazepine, and topiramate, as well as other atypical antipsychotics, for example, risperidone, ziprasidone, quetiapine, aripiprazole, and clozapine. And these medications are often combined together with antidepressants or anxiolytic agents. In this video, we are only going to focus on the use of the mood stabilizer lithium. So, the definition of a mood stabilizer is actually a medication that is effective in treating or preventing manic, mixed, or depressive episodes without triggering episodes of opposite polarity. So basically, a mood stabilizer actually serves to create a balance between the manic as well as depressive episodes that are usually experienced by people with bipolar. Lithium is the most widely used and studied medication for treating bipolar disorder. It seems to help in reducing the severity and frequency of mania and may also help in relieving bipolar depression. Studies have also shown that lithium can significantly reduce suicidal risk. It also helps preventing future manic and depressive episodes, and as a result, lithium may be prescribed for a long period of time as maintenance therapy. The efficacy of lithium as a mood stabilizer seems to be attributable to various mechanisms of action, but in general, lithium has activity or can exert its actions on various neurotransmitter and secondary messenger systems, and it seems to have neural protective activity as well. Basically, at neural level, lithium reduces excitatory neurotransmissions but increases inhibitory neurotransmission. And lithium appears to preserve or increase the volume of brain structures involved in emotional regulations such as the prefrontal cortex, hippocampus, and amygdala. Dopamine is an excitatory neurotransmitter that plays an important role in pathogenesis of bipolar disorder. Dopamine transmission is known to be elevated during mania. Therefore, lithium inhibits excitatory neurotransmission by decreasing presynaptic dopamine activity and by inactivating postsynaptic G protein receptors. Glutamate levels are found to be increased in mania and decreased in depression. Acute administration of lithium increases the level of glutamate via the activation of the NMDA receptor and inhibition of its uptake by inhibiting glutamate transporter. And this would explain the antidepressant effect. However, chronic administration of lithium would lead to NMDA receptor downregulation with glutamate reuptake of regulation, resulting in lower levels of glutamate, which explains the mood stabilization effect. GABA is an inhibitory transmitter that also plays a role in modulating glutamate and dopamine. Patients with bipolar disorder have diminished GABA neurotransmission, and thus these low levels of GABA can result in excitatory toxicity. Therefore, lithium actually works to reduce neuronal excitation by increasing the level of GABA. Essentially, at a neuronal level, lithium reduces excitatory neurotransmission, which is dopamine and glutamate, but increases the inhibitory GABA neurotransmission. However, these broad effects are underpinned by complex neurotransmitter systems that strive to achieve homeostasis by way of compensatory changes. So for example, at an intracellular and molecular level, lithium targets second messenger systems that further modulate neurotransmission. For instance, the effects of lithium on adenyl cyclase and phosphorinositide pathway as well as protein kinase C may also serve to dampen the excessive excitatory neurotransmission that happens in bipolar. Aside from its action on the neurotransmitter and second messenger system, lithium is known to provide neural protective effect. So we are now going to look at the mechanism underlying lithium's neural protection. Lithium reduces glutamate levels and increases the GABA, thereby reducing neuronal excitation and the consequent cell death. It also is associated with increased neurotropic factors such as brain-derived neurotrophic factor (BDNF) and also neuroprotective proteins such as BCL2 group of proteins. Lithium also increases N-acetyl aspartate NAA, which is a marker of neuronal health and liability. And last but not least, lithium competes with magnesium in several enzymatic reactions at substrate sites that require magnesium as cofactor. In particular, lithium inhibits the enzyme GSK3B and inositol monophosphate IMP, both of which have implications in neurodegenerative diseases as well as being relevant in neuropsychiatric disorders.